Hello to all the ladies. I am Dr. Gaana Sreenivas, Consultant Obstetrician and Gynecologist, Rainbow Hospitals, Bannerghatta Road. Heavy periods or heavy menstrual bleeding is one of the most common reasons why women visit OPDs, and especially when it manifests as low hemoglobin, weakness or tiredness. And Indian women are more of suffer in silence types, wherein they do not come to the doctor unless and until they have their hemoglobin drops too low or the features cannot be endured furthermore. So I'm going to give you a little tips and tricks and a little information on heavy menstrual bleeding. First of all, what is heavy periods? The first thing, if you are changing your pads every 1 or 2 hours a day, then definitely that's heavy periods. The other thing, if you have menstrual bleeding for more than 7 days or for more than 100 ml. So previously quantification was difficult, but now most of the women are transitioning towards menstrual cups, and so the quantification is easy. The third point, if you are passing more than a 10 paisa coin, that is 1.5 inch clot, so that is one of the feature. If you are using double protection, if you are using a pad and a tampon, a menstrual cup along with a pad, and still staining your clothes, so that quantifies as heavy menstrual period. And the feature being dizziness, weakness because of low hemoglobin. Most women can quantify for themselves if they have heavy periods. They are the best judge. If they feel that their periods are more than the regular periods, then visit your gynecologist. So what are the causes? The most important one, if you have non-cancerous conditions like fibroids, if there are the endometrium or the thyroid disorders, that's one of the causes, or if the endometrium, popularly known as the uterine lining, if it gets thickened, that is called hyperplasia, or if the uterine lining migrates to the muscles or elsewhere, called as adenomyosis and endometriosis. Also, if you have a growth in the uterus called as polyps. So all of these are the major causes. Along with that, very rarely cancers. So what are the tests that we do? One is hemoglobin or the complete blood count, thyroid levels we check. Also we go in for a pap smear and an ultrasound. Those are the basic tests. Rarely women require a test called hysteroscopy, wherein we put a telescopic light inside the uterus and see for the endometrial or the uterine lining. So how do we treat it? So treatment is first diet modifications. Eat lot of vegetables and fruits rich in iron, green leafy vegetables, dates. So this will help you tide over the symptoms. Along with that, the treatment part is individualized. Every woman has different symptoms, different causes, so we treat according to the causes. Most of the times with medicines, the symptom gets gone. Only very few women require surgical options. So I would like to mention at this point something called the LNG IUCD, or popularly called as mirena, or the copper T that is with the hormones. It has worked wonders for heavy menstrual bleeding, reducing our surgical rates to almost 1 to 2 out of 100. Many women have benefited out of it. So ladies, if you have heavy menstrual period, do not hesitate, come over to us. There are the treatment options are rationalized. Surgery is not the only option. There are various treatment options available right now. So all of y'all, do not suffer in silence and visit us at the earliest. Yeah, thank you.